Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in this video I want to keep you active, right? I want to keep you squatting. And so we're going to talk about some different ways you can continue to squat despite feeling a pain in the back, butt, or leg. And so many people come to me with herniated discs, arthritis in their spine, Piriformis Syndrome, other types of things that are irritating their back, hip, butt, or leg. And they just come to this conclusion that, well, squatting hurts and I guess I can't squat. And so if you're watching this, maybe you love going to the gym, maybe you love squatting, and you used to be strong, but because of the pain you're experiencing, you just stopped doing those things. Because you've been led to believe that squatting or deadlifting and doing other leg exercises in the gym are maybe what injured you, and they're bad for you. And if you've watched any of my content, you know I'm not a big fan of throwing anything into the bad or good category, but instead giving you the tools, knowledge, and understanding that you need so you can identify what's going to work best for you. And in this video, I'm going to show you a bunch of different squat alternatives. So you don't just have to cut out squatting cold turkey, but rather you can start to think outside the box, get creative, and come up with some of your own ways to find a way that you can still squat. Because the goal, again, is always to stay as active as possible. Research clearly shows that people with back, butt, sciatica problems who choose to rest and avoid activities altogether do worse than people who stay as active as possible. Right now, it's one thing if squatting is a 100 out of 100 pain, but even using these variations, you might find ways to move more comfortably. And the issue with avoiding things and just going into full-on avoidance mode and not going to the gym is that while your body might be healing because you're not nicking the scab physically, psychologically you're reinforcing that whatever you're avoiding, the squat, is clearly dangerous. And so you're grooving neural pathways to start to set you up for chronic pain while squatting or going to the gym. All right, so let's keep you squatting. I'm going to show you some alternatives here to help get your juices flowing. And by the way, before we show you a bunch of different ways that you can continue to stay active in the gym and continue to squat, if you're not sure of the cause of your back, butt, or sciatic problem, click above to download my Better Than an MRI DIY diagnostic guide. Helps you figure out the most likely source of your symptoms for free. Here we go. So the traditional way to squat, maybe you do back squats or you do goblet squats or you do whatever, right? But again, a lot of people think of a squat as this. Go ahead, squat on down. No instruction, just squat on down. What is a squat? Okay. That's a squat. All right, so notice I had her self-select her squatting preference. And maybe it looks like you have a barbell, maybe it looks like you have a broomstick. Maybe it looks like you hold a weight in front of you or no weight at all and you do air squats. It doesn't matter. Whatever squatting looks like for you, you have some stamp in your brain of what that means. That's a good thing because, well, you know how to squat, right? But what is squatting? Who said that that was the only way you could squat? And so do you see how we just say, oh, well, because that hurts my, let's just say in this case, your left butt cheek as an example, maybe she has Piriformis Syndrome or sciatica, I'm just going to avoid squatting altogether. I can't squat because when I do your squat, it hurts, Charlie. Are you serious? There's a million other ways to squat, right? Now, if you buy into the belief that there's a right way to squat or a wrong way to squat, you may put yourself into this box of avoidance when you don't have to. And so we want to keep you as active as possible, and that's going to be the value in this video, all right? So if you're squatting and you're getting symptoms, by the way, if you get symptoms that are low being low yucky, we'll call it, all right? We have low, medium, and high symptoms. Low would be a 10, 20, 30. The higher the number, worse it is. I'm doing a 0 to 100. Medium, 40, 50, 60. High, 70, 80, 90. If you're doing symptoms that are, if you're squatting and you're getting symptoms that are low to low moderate, maybe like a 10 to a 30, so go ahead, you squat on down and you say, ow, 10 or 20 or 30 in my left butt cheek. And now you stand up and you say, they're all gone. Then I'm going to say, what are you worried about? It's clearly not an inflammatory process, which is a chemical process, and that doesn't flood your body and then go away, flood your body and then go away, right? And so it's purely mechanical if you squat down, or likely mechanical. It could be your brain saying, ouch, and training to feel symptoms when you do this. That's a topic for another day. But if it's on and it's off, the chance you have to avoid that and the chance that you're doing any type of damage to the tissue in your body, very, very low. So I would say in that case, you probably don't have to tweak what you're doing. But if symptoms are 60, 70, maybe 50, 60, 70, 80, 90, so when you squat, you're like, ugh, and we're really grimacing, and the more you do it, it gets worse and worse and worse, chances are you're probably flared up later. But again, if symptoms are low to low moderate, 10, 20, 30, maybe 40, the more you do it, the better it gets, or it's on and it's off very quickly. You probably don't have to go through these alterations. You have my permission to touch the symptoms and come off, touch the symptoms and come off, so long as they are not worse later on, and or with repetition they get better. All right, so this is for people who just can't squat because symptoms are too yucky. All right, so that is the way that you kind of have self-selected or been taught or in your brain have been led to believe that you should squat. But that's not the only way to squat. All right, so you can, if you want, so one way to think about this is to divide the body into the lower half and the upper half, right? And to do a squat, you could argue that you have to kind of hinge your hips forward, and you could argue that's moving your body forward from below or forward from above. So we're going to manipulate both above the belt line and below the belt line to find if we can discover a way that you can squat pain-free, all right? So let's start with below the belt line. Hopefully you can see her legs here, right? What you're going to do is instead of squatting just like you normally do, all right, I'm going to have you do a wide squat. We'll do both legs first. So we have the upper body and the lower body, and then we have the right and the left side of the body. And so we're going to manipulate all these variables and find one that works, all right? And so go ahead and squat now. And you're going to tell me yucky or yummy. Same, better, worse. Compared to your first squat, your normal squat.
Okay, better.
Okay, so she could be done. I found what makes it better. Takes away my symptoms. Great, that was a short video. All right, now let's just say, let's put your feet together. So we're kind of moving both sides of the body. I'm making this up on the fly. Get creative. Now go ahead and squat. Okay, same, better, worse.
Worse.
Ah, that makes sense. Going wide makes her feel better. What's the opposite of wide? Narrow.
Yeah.
What's the opposite of makes me feel better? Makes me feel worse. Okay, so normal squat, feet kind of shoulder width, makes her feel her baseline, whatever that is. You know, I forget what it was, all right? But wide makes her feel a little better, narrow makes her feel worse. Now, let's go ahead and start splitting up different sides of the body,
Okay.
all right? So go ahead and put your right leg out to the side. Put it out to the side.
Leg.
Oh, sorry, your left leg, my bad. Your left leg, and now squat on down. It's kind of almost like a little bit of a lunge, just squat straight on down.
Oh, like this.
Yeah, we'll call it maybe a surfer squat. You can put your arms out like that.
Yeah, okay.
Do you go that way or you would go
I
that way?
would
You would go that way,
Okay.
right? And so is that same, better, or worse? Now let's just say she was like same, right? Go ahead and now do the same thing on the other side. Who said a squat had to look like you putting just weight on your back and going up and down, right? And so you would say same, better, or worse, right? And you could test that out. Now what you could do is we went sideways. Why not put the right leg slightly in front of the left? And now squat on down, maybe even a little bit less. Good, yep, now squat on down. All right, a little hard to do, huh?
Yeah.
Okay, so maybe she doesn't like that. Her ankles get a little bit jammed, and maybe you don't like it either. But either way, slight variation, right? Maybe even go less, because your ankles are a little jammed. Maybe you go a little bit less. Yep, go ahead, squat on down.
I switched sides, by the way.
Yep, that's okay. Good. And now again, same, better, worse. And you could write these out. Go back, watch this video. Just write, these are all the variations Charlie put together for me. He just made them up on the fly, but he's using the top and the bottom and the left and the right, and he's talking really fast. Slow me down, go back, write these out on a pad of paper. You know, center, normal. Here's how bad it was. 0 to 100, it's medium, yucky. It's a 40, 50, 60. Give it some number. When I go wide, when I go narrow, when I go my right leg out, when I go my left leg out, when I go my right foot back, when I go my left foot back. That's what we've done so far. All right? Cool. Okay, so now what you're going to do is the body can rotate in and rotate out too. So now you're going to take your left foot and you're going to turn it in a little bit. Just a little bit. Yeah, there you go. Cool. Now go ahead and squat on down. All right, good. So we got that one. Did that help or did it not? Same, better, worse. Just circle. Same, better, worse. You can use smiley faces if you want to keep this simple. Go ahead and do that one. Okay, same, better, worse. You see how we're just manipulating things. You came into this video saying squatting's bad. There is no perfect squat form, all right? And why not, while you're trying to solve the problem otherwise, why not continue to maximize your function and stay squatting? Well, I'm going to go ahead and I'm just going to start manipulating things to find what works for me. All right, so we rotated in. Now, rotate out. Amazing. So now rotate that leg out. Now you kind of did this a little bit with a surfer squat, but not quite. So go ahead and squat on down now.
I'll keep the same distance.
Yep, cool.
Oh, yeah, I love it.
Oh, I like that one. It frees it up. You can even see it feels more comfy for her.
Yeah.
All right, now won't this cause a problem long term? No, there's no evidence to suggest that. All right, and so just do it. You don't have to do this for forever, but to allow yourself to feel better. And then eventually what you could do is if you found that turning the left foot out felt good, then you could start to gradually, as you felt better, move it back in. All right, okay, so now we'll do the right leg. Boom, okay, good. So you got that one. Now, let's see, we did rotate in, rotate out, forward, back. You could play around with maybe squatting. You've seen people squat with weights under their heels. You could play around with squatting with weights under both heels. You could put a weight under one heel. You could put a weight under the other heel, all right? And so I'm just giving you some ways to start to play around with, moving the legs, right versus left, north, east, south, and west, and twisting things to find if something's valuable, all right? Now, she just said something, great segue, very brilliantly. Or she said something really smart, all right? Which was, we talked about the lower body. Well, what about the upper body? Excellent. So now what you're going to do is, again, the upper body can go forward, back. It can tilt left, it can tilt right, and it can twist. So we've got now these options. Now, don't twist yet. It's just not my juju to go in that order. You're messing it up. All right? So go ahead, and what I want you to do is I want you to squat, and I want you to lean forward. Maybe, by the way, I would have some TRX straps or some bar in front of me. So go ahead and hold my hands like I'm the bar. And now go ahead and squat down. So you're going to be a little bit more hinged forward, and we're going to see, does my body like being more hinged forward, which tends to load the glutes and the back side of the body? We don't really care about that much because we're going off your symptoms. Let's get back out of theory land, and let's go to how you feel. Same, better, or worse?
That's better.
Great. You could stop there, and that could be the way that she squats, right? Until she feels like she's improving and move back to a more natural position. All right, so she's got that one. All right, and then we could say, all right, what if we could do a more vertical squat? So now what I want you to do, sometimes again, vertical squat shifts the load a little bit more to the front of the thighs. You could hold on to something in front of you and keep more of a vertical trunk. So I can do that. So here, I'll be this. So very vertical with the trunk. You could do that, all right? You could put something underneath your heels, and that generally forces you to be more vertical. There's lots of different stuff that you can do to stay more upright, but that's the idea. So can you stay more upright with your spine, more like this if you hold on to something, right, versus this? There's a difference there, potentially for you, all right? Now, let's keep going and I'll come back to that, all right? We did forward, we did back, but we can also do side to side. So now what I want you to do is just tilt slightly to the left and go ahead and squat down like that.
That's fine.
You might say, that's totally weird. You can't do that. Who said you can't do that? All right. How does that feel? Right. Go ahead, down to the right. Great. Okay. Now we went forward, back, right, left. Now we're going to do what?
Twist.
Twist. Here we go. Now it's in my order. Okay. So go ahead and twist your trunk to the right and now squat down. Good. 1 or 2 reps. See how that feels. Does that allow you to squat pain-free or not? Same, better, worse. Go ahead. Other side. Great. Same, better, worse. I mean, the other thing you could do is you could just say, hey, all those things, I don't like them because I'm using both legs. You could simply just choose to do maybe lunges on your good leg, right? So sometimes people say, okay, I went through all those squats, it doesn't really work. Well, if you have sciatica or a pain in your one butt or leg, why not still maximize the function of the other leg? We get so obsessed with hey, I've got pain in my left butt cheek, so I've got to focus on that and do something right there. But okay, you're focused on what you can't do, but you can do this, you can do this, you can do this, and you can do this. Why not do something else to maximize the function, right? So maybe if your left butt cheek is the problem, you could do a right lunge. All right, so go ahead and do a right lunge. So you could do something like this. That's a right lunge. Or on the way up, you could push yourself back. You could do something like that. Not exactly. Push yourself up and bring your foot back to meet your other foot. There you go. I know you're trying not to hit that. I get it. Okay. You could step out to the right side. Now we kind of did this at the beginning and step back in. You could scooch up. You could step back with your left leg. Perfect. Very good. All right. And so look, you could do step ups. You could face and say, all right, well, maybe a lunge doesn't really work, but you could do step ups with your good leg, right? And so I know I'm throwing a lot of different things at you, but I think the gist of this video is to help you see there are just so many ways to do different things. You could do arms. Yeah, I mean, that's a topic for another video.
Okay.
All right, but the idea is that she's right in thinking that so many times when people have pain in the butt, right, just like I mentioned, they forget that everything else works. So they just say, I can't squat. I can't do leg exercises because I have sciatica. That's not true, all right, most of the times. It's true in your brain because you have this perfect world of what working out and squatting looks like for you. But if this is off limits, well, you can still do pull-ups. You could still probably do push-ups. You could still do dips. You could still do bench press and this and that, and you could still maximize function of everything that is working, right, to get some type of cross-education, we call it, or overall just continue to build the resiliency within the system while that's maybe off limits. And, even some alternative options, if you will, would just be to simply, okay, maybe you can't squat at max depth, but you could touch your butt on a box. You could do box squats. Find a height, maybe it's not that height, but maybe it's a little higher that feels safe, and start there. Well, Charlie, they don't count as squats. Who said they don't count as squats? Forget, just drop the word squat. Does it allow you to do movement that sort of reminds you of a squat, pain-free or not, or with much less symptoms? So, and then what's cool about doing that is that then you have a read on, all right, I started here and I couldn't do that, but then I started to work myself lower and lower and lower, and I know I'm moving in the right direction. So doing some form of box squat that objectifies how far you can go is often a useful place. The other way you could do it is by reducing load. So we talked about body positions, but maybe you're somebody who's used to squatting, I don't know, 135, 225, 315, a million pounds, right? And you can't do that right now. And you want to keep squatting. Well, you could potentially just reduce the load and increase the reps and start there. The maybe final one or two things, because we could probably come up with a million examples here, and I would challenge you to continue to come up with ways of squatting as much as needed, as little as necessary, and rather than just coming up with ways blindly, trying them on, you could do something we call, or I would call, a hover squat, which is an isometric squat. So many times an isotonic motion of you squatting down and going up, squatting down and going up is a little bit threatening for people, especially if you have disc problem, piriformis problem, you're contracting, relaxing, contracting, relaxing. You're bending forward, transitioning, flexion, extension, all right? What you can do is you can find a motion, an isometric motion, you can get in and you can just hold it there. So it requires less exposure to the thing which is threatening, but still allows you exposure to it such that you're not avoiding it. Psychologically, you start to reduce the threat or the danger around it, and you still get the feel-good burn physiologically in your body associated with squats. So you could go down, tap your butt on the box, or you could do it freestanding, but a box is usually helpful, and hover 1 or 2 inches and just hold there, and hold, and hold, and hold, and hold. And you could do, say, 6, 10-second holds, and you could still get 60 seconds, right, of work, and you still get a burn in your thighs and your butt and everywhere, but you're not constantly having to deal with these transitions. And so an isometric squat hold is often a safe place to start versus going up and down and lots of movement is maybe more threatening if you want to think of a spectrum of more safe to less safe, all right? The final thing, actually I keep saying the final thing, but would be location of where there is load. So maybe you reduce it just to a squat without any weight, but maybe instead of doing a back squat, you do a goblet squat, or you hold a dumbbell between your legs. And there could be many ways, or you could hold a dumbbell on one shoulder, or the other shoulder, or suitcase kind of squat. You hold a dumbbell on the right side, hold a dumbbell on the left side. There's just endless possibilities. And so if you're watching this and you're just like, I can't squat, and therefore I don't go to the gym, I'm not buying it. Somebody isn't being very creative. It might be you, but in all fairness, you probably haven't been taught to think outside the box. Or it may be a provider or a doctor who just has this blanket rule of like squats are bad. It couldn't be further from the truth. In fact, squats are kind of good. And by the way, if you don't know how to squat, you don't know how to get off the toilet, right? And so the neat thing about this is where it takes you even beyond squatting. So if you found, for example, your yummy squat, I would say the best one I saw your eye light up was that one, right? You're like, oh, I like that, right? For whatever reason. And so guess what? If you're like, oh, getting off the toilet is terrible. What is getting off the toilet? Your yucky motion is a squat. No wonder you can't get out of the car. That's to squat. No wonder you can't go to the gym. No wonder you can't get off the toilet. These tweaks drop clues like cookies drop crumbs, and you can start to say, wow, that squat feels great. So now every morning when I get off the john, I'm going to rotate my leg like that. And before you know it, I feel better. Amazing. Not really amazing, just solid detective work and thinking outside the box to find something that makes your symptoms feel better. It allows you to stay active. It allows you to continue to expose yourself to that thing which your brain is deemed to be threatening, which starts to turn down the fight or flight response to it, reduces the fear and worry and concern, also slows me down, right? And allows you then to take that and carry it over to life so that you might find, hey, what else could I do that rotates my leg like that? I got things that look like this. That's weird. I got things that look like that. I got stuff that kind of moves me that way that maybe I could turn that into an exercise to solve my problem. Pretty cool stuff, all right? The final the final thing you could do, it has to do more with the psychology of squatting and pain, all right? And so rather than just trying all these physical tweaks, if you're just like, nope, can't do it, I'm out, I tried everything, chances are you haven't tried everything, go through the video again, is that you could imagine or do something I call creative visualization of squatting. Right, so for a lot of folks, if squatting equals pain, and the more you squat, the more you hurt, and if you've injured yourself multiple times squatting or doing whatever, then you start to develop this association, or what we call a learned response to squatting. Squatting equals bad. If I squat, I will hurt more. All these different things, and so you've trained your brain to be like, that thing I shouldn't do, right? Squatting is not good. And so what you can start to do is you can start to visualize yourself squatting in a pain-free way, right? And the cool thing is through that visualization, the brain doesn't know the difference between like a real image and one that you actually just place within the field, if you will. And so if you can imagine yourself squatting pain-free, you can actually activate the same motor neurons that are required for squatting just through visualization, right? So a lot of athletes do this. You'll see their primary motor cortex, the movement cortex of their brain, light up just through visualizing the actions. And so you can do that and visualize yourself squatting pain-free, whatever that looks like. And you can try it before squatting to sort of set you up for, or prep you, or prime you for lack of better terms, the squatting itself. Or you could simply just visualize yourself without actually doing the physical action to start to reduce the fear, the concern, the threat mentally and physically. All right, so I think that's all. You can also strengthen the painful side by working the non-painful side, again, through cross-education. All right, so you can actually use the good to keep the bad strong, while you're recovering. All right, so 1,000,001 ways to squat should really be the title of this video. So you can get creative, start to think outside the box, find a way to keep yourself active so you're not reinforcing things mentally or physically. You stay strong so you don't decondition yourself. You still get to go working out so you're not stressed out and losing your outlet, right, for all the stuff that life throws at us, and so that you can continue to move in the right direction, all right? And then take what you find during these experiments and plug them into life so that you can start to modify or tweak the things that make you feel yucky. And then, gosh, if you're really somebody who can apply concepts and take them, find the tweak that feels good and turn it into, start testing some motions to find if that tweak is actually a clue and a window into the one motion that might solve your problem for good. Hope this was helpful. Let me know your thoughts below. Feel free, if you're interested in working with someone who can teach you how to think like this and how to problem solve through back, butt, or sciatica problems. Click the link below to apply to set up a time to chat with us. We work with people all around the world dealing with back, butt, or sciatica problems, and I would be more than happy to review your case personally. Click the link, set up a time to chat with us, and submit a case review. Gives me all the details I need to confirm if we can help. If we can't help, we'll let you know. If we can help, we'll talk about what that plan looks like. Go ahead, click the link below.